apply the transdermal patch. So the first procedure is we're going to gather the equipment, check the medication order against the original physician order according to the agency policy, and we're going to clarify any inconsistencies and check the patient allergies. And then after that, special nursing consideration and the adverse effect of the medication to be administered, and consider the appropriateness of the medication for the patient, and then perform the hand hygiene. And then after that, you're going to prepare the medication for one patient at that time. So next is you're going to read the mark and select the proper medication from the patient medication drawer or unit stock. So let's assume that I'll do it. So let's compare the label with the mark medication administration record, and we're going to check the expiration date and perform the calculation if necessary. Compare the label with the mark or medication administration record, and then check the expiration dates and the perform calculation if necessary. So after that, you're going to, when all medication for one have been prepared, we are going to check the label with the mark before taking them to the patient and return the medication stock to the patient's drawer. So let's assume that I'm done returning the medication to the patient's drawer. So we're going to transfer the medication to the patient bedside carefully, and then keep the medication in sight at all times. So let's assume that I'll do it. Then ensure the patient receives the medication at the correct time. So we're going to the next step, identify the patient. Usually the patient should be identified using the two methods. So first is you're going to check the name of the patient identification band, and if the patient cannot identify him or herself, verify the significant to the others. So let's assume the patient can identify herself. So I ask my patient, Ma'am, ano pong pangalan nyo? Ano pong birthday nyo, ma'am? So after that, complete the necessary assessment before administering the medication. Check the allergy bracelet or ask the patient about the allergies, and you're going to explain the purpose and action of each medication to the patient. So let's check the allergies. And then after that, let's assume that I discussed the adverse effect of the medication. We're going to perform the hand hygiene and put on gloves. So assess the patient's skin where the patch is to be placed, looking for any signs of irritation or breakdown. Sites should be a clean, dry, and free for skin, and rotate the application site as per doctor's order. Remove any old transdermal patches from the patient's skin. Cut into half or fold the old patch in half with the adhesive sides and sticking together, and discard according to the hospital policy. And then gently wash the area where the old patch was with a soap and water. And then you're going to ensure the glove's hand is thoroughly drying before holding the new patch. So next, remove the patch from the protective covering. Write your initial and the date and the time of the administration to the label side of the patch. So after that is remove the covering of the patch without touching the medication surface and apply the patch to the patient's skin and use a palm of your hand to press firmly about 10 seconds and do not massage. Then after that, you're going to remove the gloves and perform the hand hygiene. So next is you're going to evaluate the patient response to the medication with the appropriate time frame. And the last one is you're going to document the procedure in the patient chart.